Hey guys, Ashley with Amare. So few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, it's Ashley with Amare. So today we are talking about how to get rid of swelling after surgery. So this is going to be kind of an article, kind of a me giving you the truth here. You guys, this is not, I don't understand why when we look for information and we do our research, your research is from people who aren't certified in any kind of medical anything, right? So one of my clients yesterday was asking me, she's like, well, shouldn't we just like poke me with a needle and get the swelling out? I mean, I know that's not what you're supposed to do, but why doesn't it work like that? And I'm like, oh boy, here we go. Okay, so let's start by saying my analogy that I use for everything. When you stub your toe, do you stick a needle in it to get the swelling out? No. When you burn your hand, do you stick a needle in it to get the swelling out? No. The body doesn't function that way. That's not how it's designed to function. That's not how swelling works. That's not how the body works. So before I get into all of this, I know a lot of you guys are finding this video because you're seeing all this craziness online. I need you to take that idea of needing to drain swelling with a needle out of your body. Take that idea, throw it out the window. That is not how the body works. No. What I need you to understand is your body drains all fluids through your urine. You pee it out. That's how you drain anything in your body. Your body is doing drainage of swelling 24/7. You are peeing out the fluid you drink, the interstitial fluid that becomes lymph fluid that is swelling. You are peeing it out 24/7. This is why we're not walking around in the world like giant, swollen, puffy balloons all day. This is why after a night of drinking, or if you have a pimple or something like that, it goes down on its own because your body's constantly doing this drainage on its own. And I understand the word drainage trip you guys up because you think it has to be drained outside of the body. That's not how it works. You are draining 24/7 through your urine all the time. So when we're talking about draining swelling after surgery, it's working with what's already there. It's your body already draining that stuff out through your urine. So to put it into perspective, I have an article here, as always, Better Health Channel. And the one part of this article that I'm going to read, because the rest of it isn't pertaining to plastic surgery. It's pertaining to like all around swelling. So I don't want to like deviate from that. So it says about fluid retention. Now, here's the other thing that drives me up a freaking wall. Guys, you are not, after surgery, retaining water. That's not what's happening. What's happening is you had an injury, which was surgery. You got cut. Your body swells because swelling is healing juices. It's bringing in white blood cells, fats, all of those things that it needs to heal the tissue. So your body is swelling. It's bringing in all of those things, and then your body's supposed to be getting rid of it. You're not retaining. What's happening is you are doing things like the wood therapy, like compressing the crap out of yourself with a garment that is 10 times too small, like wearing boards, like all of these things. That's trapping the fluid inside of your body. Your body's not retaining. Your body's trying to get rid of it, and you're getting in the way. And we're going to talk about that at the end of this video. So about fluid retention, which I hate that word. Anybody who knows me knows that I hate the words fluid retention because it just feeds into the stuff you guys see on Instagram, all of that craziness. Fluid regularly leaks into the body's tissue from blood. Oh, so where does swelling come from? Swelling comes from an injury or leaking out from blood, right? The lymphatic system is a network of tubes, they're not really tubes, but okay, it's a network of tubes through the body that drains this fluid called lymph, swelling, from tissue and empties it back into the bloodstream, right, from where it leaked out because of surgery. Fluid retention, edema, swelling, occurs when the fluid isn't removed from the tissue. Okay, so the fluid's not being removed because we're doing body contouring, we're doing rollers, we're doing garments that are too tight, we're doing boards, we're doing things that are trapping that fluid in the body, okay? Two broad categories of fluid retention include generalized, which is when swelling occurs throughout the body, that's not plastic surgery, localized, which is plastic surgery, when particular parts of the body are affected. The wide range of causes include the body's reaction to hot weather, so heat. So all of these are vasodilators. So let's talk about this real quick. Vasodilation is a fluid where the end of the blood vessels and capillaries dilate and more blood is poured into the tissue or leaks into the tissue. So like this first sentence said, fluid regularly leaks into the body's tissues from the blood. So things that'll cause vasodilation, that'll cause those little ends of that, like let's call them blood tubes, to open up is going to cause more fluid to leak into your tissue after surgery, which is going to cause more swelling. So we're not retaining, right? Swelling was caused from an injury. There's no reason we should be swelling more, right? Swelling came from the surgery. It's these things that you're doing that are causing more of that blood and vasodilation to leak into the tissue. So wide range of causes include hot weather, right? Heat dilates, high salt intake, vasodilation, and hormones associated with the menstrual cycle. However, it is recommended that you see a doctor rather than treat yourself because it can be a symptom of serious medical conditions such as heart, liver, or kidney disease. So that's not, we're talking about surgery. So those things you've already been cleared for if you've had surgery. And then it just goes into symptoms, which obviously we know, like pain, heat, swelling. Okay, so causes, again, it goes into hot weather, burns, other things that are not related to plastic surgery. So that's pretty much all I wanted to read from this for you guys. So let me just real quick, guys, swelling is supposed to be there. Swelling is healing juices, okay? So how do we get rid of it? As it said before, this lymphatic system, right? Why isn't it just called, swelling drainage massage? Because it's lymphatic drainage massage, because what we're doing is working with the lymphatic system. So here is the system. It's a bunch of little lines. These little lines, these vessels, are a hair thick and lie a hair deep beneath the skin. So knowing that, and knowing that that's what's responsible for reabsorbing your swelling, and then it travels back into your subclavian veins, and then you pee it out, right? It goes back through your bloodstream, your heart, your liver, your kidneys turn it into urine, and then they pee it out, right? So knowing that, if we're trying to, dilate this vessel, the same way vasodilation, right, like we just learned, the same way that works. If we're trying to get this vessel, this tiny little thing, to absorb swelling, do you think using a roller is going to do that? No. Do you think using a machine is going to do that? No. Do you think using oil and just rubbing the living daylights out of this thing is going to do that? No. Manual lymphatic drainage. What does that mean? We are manually, so with our hands, by moving the skin, we are manually stretching and dilating these hair-thin vessels, manually dilating the lymphatic vessels, getting them to do their natural job of drainage. All we're doing is speeding up the intake process of that swelling. That's how we get rid of it. So when we're talking about draining swelling after surgery, we want to drain it back into the body, not stick a needle in you and drain it out of the body. That's not how that works. Also, side note, I have a million videos and tons of posts on Instagram about how that is illegal for massage therapists to do. That is not legal at all. That's called aspiration. When you stick a needle in and pull fluid out, that is called aspiration. Aspiration is meant to be done by a certified licensed medical professional who is allowed to use sharps. Sharps meaning needles and things like that. So when you're talking about aspiration, that is something that is only to be done and determined, that is necessary by a doctor, by someone who is medically certified. You guys out there who are calling us constantly and being like, well, I need to be drained, you have no idea what you're asking for and you have no idea what you're talking about. That is not how the body drains swelling. That is aspiration, to be done and determined by a doctor or medical professional. Please stop calling lymphatic therapists and asking them to drain you with a needle. That is not legal. We are not allowed to do that. We will not be doing that. And if someone is going to do that for you, they should be a medical professional. And they should be able to look at you and determine if you need aspiration, not just a massage therapist who's sticking a needle in you. That's not okay. That's not how that works. So if you call someplace and you're like, if you find this video afterwards and you're like, oh, I need to be drained, I need you to drain me with a needle and squeeze fluid out of me. And they're like, oh yeah, we do that. Absolutely, sure. And it's, $100, $80, $60 to drain you. Check their credentials because they're probably not a licensed massage therapist or practitioner. And if they are violating their license directly. That is not how swelling works. So enough of that rant. I have multiple videos on that. You can go and watch them to learn why it's not legal and all that stuff. So draining, right? Okay, so now we know that it drains back into the body via the lymphatic system. The lymphatic system is a hair thin and a hair deep beneath the skin. Cool. Okay, how do we dilate it? I want you guys to picture a spider web with water on it. Then you want to take the water off of the spider web with your finger. That's what we're doing. There's a couple different strokes. So another thing, anyone who tells you lymphatic massage is rubbing you with oil, that is not correct. Again, would you put oil on a spider web to get it to stretch? No, you're gonna slide right over it, the oil's gonna stick to it, and you're gonna break the spider web. That's not how it works. Manual lymphatic drainage consists of a couple different strokes. The strokes go in line with and in, conjunction with the mapping for the actual lymphatic system. So when we're talking about the strokes for manual lymphatic drainage, it's not this. That's not going to work. That's not going to do anything. These vessels they're not tubes, which again, this is what drives me nuts. It's not tubes. We can't just push fluid. If that was the case, when you stubbed your toe and it was swollen, you would be able to just push the fluid back into your body. Not how it works. So these little tubes are one end, and I actually have this little reel on my Instagram showing you, it's not an x-ray, but it's a video of imaging of a lymphatic vessel, and there's valves on each side. So it's a pressure system. Your lymphatic system is a pressure system. So when we're talking about draining swelling after surgery, we're working with this tiny little hair thin pressure valve. So one end opens and fills up. And when the pressure here gets so much, this valve opens because areas of higher concentration, fluid in areas of higher concentration will seek areas of lower concentration. So this will open up and fluid will fill up here. And then when it's full, this side opens up and fluid fills up here. That's how it works. So it's a literal drainage system, pressure drainage system. Think about a sump pump. This is how your body drains swelling. When the pressure gets too much, the sump pump kicks on and it starts pumping that fluid and absorbing that fluid into the sump pump through the little pipes and then back into your bloodstream and you pee it out. That's how it works. So squeezing yourself into a garment that's a million sizes too tight is not going to work. You're not going to get the vessels to actually activate and absorb because we are manually activating the lymphatic vessels so that they can drain twice as fast. Now, when we talk about, well, can I just wait for my swelling to go down on its own? No, not really. Because again, you are trapped in a garment. Your skin is not moving. Your lymph system is getting zero stimulation. You are not moving. You are not up. You are not about. Your muscles aren't pumping. Your body's not pumping. Your lymphatic system is not doing its normal job right now. So you would have to wait the 3 to 6 months to be out of your garment, but then your tissue is so inundated and swollen and heavy, you don't want to get out of your garment because you're in pain. And this is why people are wearing their garment for years or months and then years, because you're not actually healing, because you're trapping all of this swelling inside you. So how do we drain swelling after surgery? Manual lymphatic drainage. We get somebody who's certified and licensed, who understands the actual science of the lymphatic system, the science of how the body works with swelling, and then they work this map and the lymphatic system to get your body to reabsorb that swelling so you can pee it out. That's how we drain swelling after surgery. So a couple things that's getting in the way of your healing with swelling after surgery. The things that are keeping the swelling there, anything that's a vasodilator. So heat, salt, you physically trapping, which is the other reason this oil massage thing, calling it lymphatic massage and rubbing you with oil, is doing more harm than good, especially if you're using deep pressure. Remember when I said in the beginning that swelling is created from a thing, right? Swelling isn't just like, swelling has to be made in some way. So vasodilation, right? If you have broken tissue, let's say you have a cut on your hand, you take oil, you start raking over that thing, right? With a decent amount of pressure, like some serious pressure. The same way you guys are letting people rub you with oil after surgery, or even just back and forth, light pressure, but back and forth. You are going to break the tissue that's trying to heal. And now it's an injury, and now we restart the phases of wound healing all over again. And now we're back to the red hot swelling because we just had another micro injury to an injured tissue, and over and over and over and over. And now you want to know why your swelling's not going down and you're getting these massages, because they're not actually manual lymphatic drainage. They're just massage. Manual lymphatic drainage is a manual technique. It is not massage. It is not the same thing. So, what do we need to do to get rid of swelling after surgery? Well, we need to stay away from things that are vasodilators that will cause more blood to pool into the tissues, right? We need to stop causing more injuries. So rollers, boards digging into you, aggressive massage, machines, needles, opening your incisions. I mean, that shouldn't even have to be said, but it does. All of those things that will make more injuries, that cause more swelling, or all of those things that will trap the fluid in your tissues. That's what's going on. You're not retaining fluid. You, with all the things you're doing after surgery, because you're watching all these people's YouTube videos, are trapping the swelling in your tissue. Your body's not retaining it, you are. So that's part of it. The other thing, like I said, swelling, because of the situation that it was created in, right? So why is it when you stub your toe, it goes down, but after surgery, it doesn't? Because when you stub your toe, you still have free range of motion, your skin's still moving, and these lymph vessels are embedded in your skin. Your skin's still moving. When you're in a garment, that can't happen because we need you compressed. We need you held. Your tissue's trying to heal. We need that. So nothing's really moving. This is why you need to get your manual lymphatic drainage massages. Let's see, is there anything else in this article I want to talk about before I go into telling you guys more things about what we need to be doing? I think that's pretty much it. Oh, the ice and the heat thing, guys. Can we address this real quick? So, again, going with the science, right? Vasodilation. There's the opposite end of that, which is vasoconstriction, which is where those blood vessels constrict and allow less blood and fluid into your tissues. So sure, ice massage seems like a good idea, right? No, it's not. One, your skin is numb. Your skin has been abused. Your skin is fragile. You can't feel anything. The ice can actually damage your skin and the nerves and the tissue. You guys need the swelling in there. Swelling is healing juices. So, one, vasoconstriction, you can't feel the ice itself. You don't know if it's doing damage. And it can. Two, I have seen it in cases. Everybody will debate me on this, be like, no, it doesn't, it's just ice, whatever. Okay, I have seen cases where it does damage the skin. 2, when you're not gonna stay cold 24/7. So when your body starts to warm up again, vasodilation kicks in. What happens during vasodilation? More fluid gets poured into your tissues. You are making more swelling, the same way you would with heat. Think about this when you go out in the cold and your hands are cold, right? And then you jump into a hot shower, your hands are on fire. Or even when you come in the house, your hands are like stiff and they hurt, right? Because your body's coming back to normal temperature, you are vasodilating. So swelling is coming into the area, blood and fluid is coming into the area. We do not do ice or heat. That is not a thing. Sure, in that homeostasis phase, the first couple days after surgery, putting an ice pack over your garment, some surgeons recommend that, but 90% of surgeons don't because it's not going to help. So that's that last thing. Now, if you are preparing for surgery, if you've had surgery, if you're having a problem with swelling and you're like, oh my God, I've done a lymphatic massage, it's bullshit, it doesn't work. I've done the deep massages, I've been, a victim of squeeze massage, I've been a victim of incisional drainage, I have done the boards, done the rollers, I've done everything under the sun, it's not working. 2 things. 1, everything I just explained in this video, I go in depth about in my online course. Post-op lymphatic massage and finding a therapist, because you guys will then go and hear, oh, lymphatic drainage. Okay, I'm going to go figure out how to do that on my own. Whom on the interwebs is explaining to you this map? No one. Why? And why do I whip it out in every video? Because this is not something you can do on your own. Because all those fancy medical words I just threw at you, like vasodilation and edema and all of that, it's not something you guys are going to learn just to get rid of your swelling. You don't know how to reroute. This system is a pathway that goes in a specific way, that with those strokes need to be worked in a specific direction, need to be moved in a specific way for those vessels to actually stretch and dilate to reabsorb that fluid. If you're not doing it correctly, you're going to backflow swelling. So there's something called lymphedema, which is where the lymph system is impaired in some way, either at birth genetically or by having lymph nodes removed, where your body is swollen 24/7. Like the arm is blown up 24/7. You have to wear compression garments and you have to get manual lymphatic drainage and you have to be careful of anything that vasodilates, all of these things, right? Because the sump pumps have been removed. So you will always have swelling. So now we need to find other sump pumps on the rest of the body to absorb that swelling. And a trained lymphatic drainage therapist, decongestive therapist, certified lymphedema therapist, all the things. A trained therapist is going to know how to do that. With plastic surgery, you're not having lymph nodes removed, but if you have fibrosis, if you had a tummy tuck, this map has now changed. The landscape has changed. Everyone literally asks me, well, why don't you just teach people how to do self-massage? Because every single body is different. Every lymphatic system is different. Do you know if you have a lymphatic impairment before surgery? No. You just think it's fat. What if it's not fat? What if it's edema? What if it's swelling? What if it's also in your arms and legs? What if you have lipedema and you didn't know and you went and got liposuction of your abdomen? There is no way to know unless you're dealing with an actual clinician, which is why I never, not even my clients, you will never be doing manual lymphatic drainage, ever. There is no way. Because again, from day to day, it's different. From healing phase to healing phase. I also have a post on my Instagram of the 4 phases of wound healing. In each phase, it's different with what we need to do, how we need to work, which direction. Yes, the primary lymph nodes that we address in the beginning of each session are the same, but as far as how we're working and rerouting the fluid, that is completely different. And I teach you guys about that in the course. That's why I'm going over this. So you don't need to find a post-op specialist. You need to find a certified manual lymphatic drainage therapist. That's what you need. Not somebody who's doing lymph massage, not somebody who's doing incisional drainage or squeeze massage, or doing just post-op massage, because post-op massage is an umbrella term. Post-op massage is anything. Literally, you can literally do hot stone. Well, not hot stone because it's like a actual thing, but you could be doing rubbing with oil, using machines, cups, and a laser all in the same session and call it post-op massage. That's an umbrella term. It's like saying lipo. You could be doing Vaser lipo, you could be doing smart lipo, you could be doing air sculpt, you could be doing tri sculpt, you could be doing water assisted lipo, you can just be doing regular traditional power assisted lipo. There are a million different things. Stop looking for post-op massage and start looking for manual lymphatic drainage. That's going to be your first step. Your second step, how do you know if that person's actually doing what I'm telling you guys, what I'm talking about, following this map, following the science, working with the actual drainage system of your body that's not going to backflow or trap swelling? Well, in my course, I teach you the map. Here's my goal. I teach you guys the science so you can make the educated decision. That's the point of these videos. That's the point of the course. Because I can't be there in the room with you, looking over your therapist's shoulder, being like, no, you got to go this way. No, you got to use this stroke. No, you got to start here. No, you got to go this way, because she had a tummy tuck and now the entire bottom half of her lymphatics are not there anymore. So the fluid now has to go in a different direction. I can't be there to do that. So I need you guys to understand how this map works, how the lymph vessels work, what should be done first, second, and third, where the therapist should be putting their hands, what the stroke is supposed to be like, what the pressure is supposed to be like. So when you call and you ask this lymphatic therapist if they're certified, you know what they're supposed to know. When you get in the room, you know what they're supposed to be doing so that you can work with them. The world would be such an easier place if you guys took the time to do the research, actual research. And I realized that on the interwebs, this stuff doesn't exist for post-op. So I made a course so I can teach you post-op how this should be going. So everything from the phases of wound healing, how to take care of your swelling at home, and how to find someone that can help you get the swelling to go back into your body so you can pee it out. Because draining swelling after surgery, your body's already trying to do that. You're getting in the way because of YouTube and TikTok and all of these things, which is why I have now a YouTube and TikTok and all of these things, because no one else is telling you this. So you will learn in that course how to avoid fibrosis, how to get rid of fibrosis, what the heck is fibrosis, how to take care of your swelling, how to find a certified manual lymphatic drainage therapist, how to know if they're actually certified properly, how to know if they're doing the right thing, and overall, just how to take care of yourself after surgery. Like, this shouldn't be a mystery. This shouldn't be rocket science. This shouldn't be you saving everyone's millions of reels everywhere and trying to piece together a protocol. I give you a protocol in the course to follow after surgery. And I tell you what to do. And then you guys can make the educated decisions for yourself wherever you are in the world. So if you want to learn how to drain swelling after surgery, go take our course. It's in our post-op shop, amarepostopshop.com. The link is in the bio on our Instagram. The link will also be in the description box for this video on YouTube. If you need your supplies for post-op, that's the other thing. All of our supplies follow the science, follow the healing patterns, follow the 4 phases of wound healing, and follow the lymphatic system so that you're not using boards and rollers and things that are going to trap your swelling and work against your lymphatic system. So all of our supplies work with the lymphatic system, and I explain to you why in the videos on the product page, and how to use them and when to use them and all of those things. So that is also amarepostopshop.com. And guys, if you are in New Jersey, I am in Highland Park and Elizabeth. Even if you're in New York, I have people that come from New York, Connecticut, Pennsylvania. I have people that fly from Miami to stay for 3 weeks, 4 weeks to work with me after surgery. So if you want me to help you, I am in New Jersey, or I also do virtuals. So how the virtuals work, you guys take the course, you learn how to find yourself a therapist, and then I help you guide and direct your protocol. I build out a protocol for you. I help you with your garments. I help you with your supplies. I tell you what you should be doing when. I answer all your questions. I explain to you all your questions, fill in all the gaps that your surgeon leaves you with, because they will do that a lot. They don't really explain anything after surgery. So I explain all those things for you, get you ready for surgery, and then helping you direct your therapist. So telling them, like, what you need to be doing, how it needs to be going, how many times a week, things like that. Although I do go over that in the course so that you guys can determine that for yourselves. But if you need me and you need someone to really like put this in a straight line for you, I also offer virtuals for that. Everything else that I do in the room with you guys is the same, except my hands aren't the one that's on you. But I can help you guide your therapist in that way. But you learn that in the course. You guys will be able to do that in the course if you take the course. The course is literally the price of a virtual, but it's 4 hours. So it's like 4 virtuals in one. And honestly, it's so much easier when you guys take the course first and then let me help you answer whatever specific like micro questions you guys have about your recovery during the virtuals. So all of that, and you can set up a virtual with me or an in-person session with me by calling the office, 732-841-0142. And our lovely little scheduling coordinator can help you get set up with either a virtual or in-person with me. But yeah, guys, draining swelling after surgery is not, it's not all the things that you hear or see. Your body already drains swelling naturally. The end. We're working with that system. The end. If you want to get rid of your swelling faster, you need to be following the way that the body's already set up. You need to be following the science. You need to stop looking at all of the craziness and all of like the at-home hacks for swelling, because that's not how it works. Someone who has massive swelling in their legs after heart failure is not taking a roller to their legs. They are not using an ice wand on their legs. They are not poking themselves and squeezing fluid out of themselves. The body works the same way. The body doesn't know that you weren't attacked by a bear. The body thinks it was attacked by a bear. It's going to heal the same way. We need to work with it and not against it. And all these YouTube hacks and TikTok hacks and My Journey videos and all this craziness that you see, none of that is backed by science. None of those people are certified lymphedema therapists, certified manual lymphatic drainage therapists, 3 or 4, I don't even know how many certs I have, 3 or 4 times certified advanced plastic surgery lymphatic specialists, like certified garment compression fitters from 4 different companies. None of these people have those credentials or the science to explain this to you. So I am explaining it to you. But guys, that's pretty much it. Please stop poking yourselves and trying to squeeze swelling out of your body. Please stop squeezing the living daylights out of yourselves with a garment. And that's it. I hope this was helpful. I tried to keep this video short. You know where to find me if you need me. And that's it. Ashley with Amare. Bye.